Welcome to our channel, your trusted source for science and health updates from around the world. If you're new here, don't forget to subscribe and hit the bell icon for more educational content. Today we're discussing a fast-spreading respiratory virus in China that's making headlines, the Human Metapneumovirus, or HMPV. This virus has caused a significant surge in cases, particularly among children and the elderly. In this video, we'll cover everything you need to know: its history, symptoms, transmission, the current outbreak, and how to protect yourself. Stay with us until the end for insights into the global response and the future of this virus. What is HMPV? Let's start with the basics. What is HMPV? Human Metapneumovirus, or HMPV, was first identified in 2001 by scientists in the Netherlands. It belongs to the Pneumoviridae family, which also includes respiratory syncytial virus, RSV. HMPV primarily targets the respiratory system. While anyone can catch it, the virus is particularly dangerous for three groups: young children under 5 years old, elderly individuals above 65, people with weakened immune systems or chronic illnesses. Although it's been around for decades, this year's winter season has seen an unusual surge in cases, particularly in China. How does HMPV spread? Now let's talk about how HMPV spreads. Similar to other respiratory viruses, it is transmitted through droplets when an infected person coughs, sneezes, or even talks. You can also get infected by touching contaminated surfaces, like door handles, phones, or tables, and then touching your face. Research shows that HMPV can survive on surfaces for several hours, making it easy to spread in crowded areas like schools, public transport, and workplaces. Symptoms of HMPV. The symptoms of HMPV range from mild to severe. Here's what to watch for. Fever, persistent cough, nasal congestion or runny nose, shortness of breath, fatigue, and general weakness. For most people, these symptoms resemble a common cold and resolve in 1-2 weeks. However, in high-risk groups, HMPV can lead to severe complications such as bronchitis, which inflames the airways and makes breathing difficult. Pneumonia, a potentially life-threatening lung infection. If symptoms worsen or persist, it's crucial to seek medical attention immediately. The current outbreak in China. Let's move on to the situation in China. According to the National Disease Control and Prevention Administration, there has been a sharp increase in respiratory infections this winter, with HMPV playing a major role. The hardest-hit regions are in northern China, and most cases are among children under the age of 14. Hospitals are reporting overcrowded pediatric wards as parents rush to get their children treated. While health authorities say this surge is consistent with seasonal patterns, the volume of cases has raised concerns about healthcare capacity in some areas. How is the global community responding? Globally, the World Health Organization, WHO, and other health agencies are closely monitoring the situation. While no international emergency has been declared, experts emphasize the need for public awareness and preventive measures. One challenge is the lack of a vaccine or specific antiviral treatment for HMPV. Most patients are treated with supportive care, such as hydration, rest, and medications to relieve symptoms. However, in severe cases, hospitalization may be required. How can you stay safe? Now let's discuss how you can protect yourself and your family from HMPV. Here are 5 simple but effective steps. 1. Wash your hands often. Use soap and water for at least 20 seconds, especially after touching shared surfaces. 2. Avoid close contact. Stay away from people who are coughing or showing symptoms. 3. Wear a mask, especially in crowded or poorly ventilated spaces. 4. Boost your immunity. Eat a balanced diet, exercise regularly, and get plenty of sleep. 5. Clean and disinfect surfaces. Pay special attention to high-touch areas like door handles and mobile phones. If you or someone in your family develops symptoms, consult a healthcare professional as soon as possible. Early diagnosis and treatment can prevent complications. Should you be worried? So, should you be worried about this outbreak? The short answer is no. While the rise in cases is concerning, it's not unprecedented. HMPV, like the flu and RSV, peaks during colder months. The key is to stay informed and proactive. With good hygiene and timely medical care, most people recover without any major complications. What's next? Looking ahead, scientists are calling for more research into HMPV. Developing vaccines or targeted antiviral drugs could make a huge difference in preventing severe cases and reducing its spread in the future. Closing. That's everything you need to know about the human metapneumovirus outbreak in China. Remember, staying informed and practicing preventive measures is the best way to protect yourself and your loved ones. If you found this video helpful, don't forget to like, share, and subscribe to your channel name for more in-depth health updates. Stay safe, stay informed, and see you in the next video.